Hi, welcome to the very first episode of No Smoke, Just Vapor. My name is Asanda Gcoyi. I am your host today, and I am joined by Calvin Matlou from Frontline Africa Advisory, who is a policy manager. I'm joined also by Mr. Ket Yao, who is a consumer advocate, who is a co-founder of Vaping Saved My Life. Today, we are going to be talking about all things regulation. The Tobacco Products and Electronic Nicotine Delivery Systems Control Bill is currently with Parliament. And there's a lot of fuss about vaping, whether it is a safer alternative, why ought we care? These gentlemen will help me today to look at the most important elements that we all need to know when it comes to vaping and why this bill may be perhaps not the right medicine that is required by the industry. Kurt, I'll start with you. What's all this fuss about this bill?
I think the bill, we don't object to regulations. But I think what we find in this bill is that it literally lumps the most harmful product known to man, most harmful consumer product known to man, with a solution to the issue of vaping products, without any clear distinction. And we feel that is inappropriate because both products have different risk profiles. Smoking or cigarettes, burnt combustible tobacco, being the most harmful, and vaping being significantly less harmful.
So are you saying this is the first time vaping products are ever going to be regulated? So there's never been any law to regulate these products?
No, I'm not saying that at all. We see countries like the UK, we see countries like New Zealand, and a number of other European countries around that have regulated these products with varying degrees of restrictions and limitations, but nothing to the level what we've seen in this particular bill.
Calvin, I mean, when you consider the lawmaking process in a country like South Africa, ordinary South Africans do not think they need to care. It's happening out there. Now the bill is in Parliament. Why should I care as an ordinary South African if there is a bill on a product that I don't even use? Why is public policy making an important thing for all South Africans to know and care about?
Thanks, Asanda. Firstly, let me take you to the past month where we've had 3 judgments from the Constitutional Court where it was found that both government and parliament have not done what the court calls meaningful public participation. So that means that going out and telling people that this is coming, this is how it's going to affect you, so that people can know what's coming, and if they support, they support, if they object, they object. But the whole thing about it is give the people the chance to explain their side. So that's the problem with this particular bill, that not enough public consultation was done, and the proposals that are in the bill are going to have enormous effect on a number of sectors, but those sectors have not been given a chance to thoroughly state their case on this particular bill, because the Department of Health, in this instance, have not given them the chance to do so. Yeah.
As a vapor yourself and a consumer advocate, Kurt, when you look at this bill, I mean, the first thing that jumps out at you is the fact that it doesn't recognize tobacco harm reduction. So I just want you to unpack for our listeners and our viewers what tobacco harm reduction is about and why it's important, because I want us to take that as our point of departure in all the areas we are going to discuss on the bill.
Well, tobacco harm reduction is no different to normal harm reduction, which is, an established method in order to eliminate, or not eliminate, to reduce the harm of risky behaviors. We see this in drug policies, we see this in the fight against HIV and AIDS, is we implement measures to reduce the harm. What vaping does is it literally provides nicotine, which is what smokers are addicted to, in a safer method or a safer delivery method in the form of an aerosol. So I think that this particular bill doesn't identify or even acknowledge that vaping is part of the solution and not just another problem. And I think it's also important that we need to understand that in South Africa, we have a growing smoking rate. We're not seeing smoking rates reduce. And we also need to understand that South Africa doesn't have any smoking cessation program to speak of. We have authorized nicotine replacement therapies, but they're not subsidized and they're not provided to poorer communities who, in effect, are the people that are smoking. The majority of the smokers around the world, 80% of them, come from low middle income countries and low middle income groups. We don't have cessation programs in our public and private, or in our public hospitals, and we don't have cessation programs in our tertiary. We've only got one cessation clinic in Groote Schuur. So we don't provide any solutions for the average smoker to go out and try quit. It's a quit or die approach using a cold turkey method, and we know that this is incredibly unsuccessful. We just feel that vaping, like myself, who smoked for 20 years at 40 cigarettes a day, finally was able to quit smoking through the use of nicotine vaping products.
So if I understand correctly, so the bill seeks to decrease the number of smokers. So this is the overall idea as far as Department of Health is concerned. So we all agree that the number of South African smokers is out of control. Something has to be done. But where we then disagree is adding another toolkit to this toolkit that already exists where health is concerned, to say try vaping as well, because it is proving in many countries that have embraced tobacco harm reduction that it does work. It does work to help people move away from the deadly cigarette smoking to a less harmful alternative. But you often hear, and I think getting now into the merits of vaping versus smoking, where you would hear even doctors saying, but it's not like oxygen, you know. So I just want you to talk about that, where people are comparing vaping to someone who doesn't use anything, when how I understand it is you should be comparing vaping to smoking. So just give us an overview on how you frame it.
Well, I think vaping should only be used by people that are nicotine dependent, that consume combustible tobacco. It is a substitute, a safer substitute, and that's been recognized widely by many public health groups as well as schools. I think we all agree, compare vaping to fresh air, there's a distinction. But we shouldn't be doing that. We should be looking at vaping compared to smoking, because we do know that 1 in 2 people die prematurely from smoking. Long-term users, 50% of them die, and they die from cancers and respiratory disease and cardiovascular diseases. And in South Africa, we've seen 40,000 South Africans die every single year from smoking-related diseases. We need to put measures in place where we can provide a solution or a substitute where people then remove that harm whilst still consuming the nicotine, which is what they're addicted to. It gives them the best option to quit altogether. And in some cases, people won't be able to quit nicotine altogether, but at least there will be less harm associated in their practice. And that is what harm reduction is about.
Calvin, we've got individuals like Kurt, we've got different key opinion leaders across the world who speak about the harm-reduced character of vaping. Many studies have come out over the years. How is it from a public policy making process that all of this information has been missed? I'm using the word missed deliberately, to a point where we are now sitting in Parliament with a bill that's not fit for purpose, a bill that disregards some of the information we're just hearing now. What does that say about our public policy making process, and what has happened to get us to be where we are right now?
Firstly, let me say, evidence policy making is the cornerstone of policy making in South Africa. So that means that whatever policy you are putting to the public must be based on evidence, and the objectives must be clear. In this instance, the objective is to decrease smoking, as you said, but at the same time is disregarding other evidence that's coming in support of vaping. So you have a vast number of studies out there that are saying that vaping does work. Not only vaping, but other nicotine alternatives do work. But it's been discarded because we have policy making that's seemingly based on ideologies, that's one-track minded, where our policymakers, even our government in this instance, once they've set their mind on something, they go disregarding anything else that comes from the side. We saw that in 2020, when the smoking sales were banned, that what happened afterwards was an explosion in what we call illicit trade. People were still smoking, but they were not getting their smokes through legal means. They were getting their smokes through other means. At the same time, money that was meant to buy food, for instance, was used to buy cigarettes because, like Curtis said, smoking is addictive and it's hard to just quit overnight. There has to be a journey towards a person quitting. And there's evidence out there that says that with the use of vaping and other nicotine alternatives, you can take people through that journey of them ultimately quitting. But this evidence simply being ignored, which is the downside of policymaking in South Africa nowadays. And as we started, I spoke about the 3 court cases where we have bills that were meant to fix something else, but now they have to restart it from the beginning. So you've lost about 2 to 3 years that you could have easily gained if you had followed the correct processes. Now you have to start again. So whatever you were seeking to achieve, it means now you have a 2-year delay. And if we look at the tobacco bill in this instance, it was first introduced in 2018. The world has changed. South Africa has changed. The landscape has changed. We had the pandemic, as we were saying. So what was true in 2018 is no longer true in 2013. And that is the backbone of policy making, that you base it on current evidence. And current evidence does not support the
draconian
measures that are being put forward, where you have people that are smoking, an increase in smoking, and those people are not getting their smokes through legal means.
Channels.
So you don't know what those people are smoking. So instead of lessening the burden on the public health system, you might even increase it, because now you don't really know what you're dealing with.
So just to cut you there. So let's talk about what the bill is currently proposing. I mean, I know, Kurt, from an industry point of view, there's quite a number of clauses in the bill that people should be worried about, you know. I mean, I'll give you both a chance to highlight some of the ones that jump out at you. But I think the fact that the bill wants to give the minister full control to make changes as and when required on the industry in terms of the ingredients used, what information goes where, essentially giving the minister powers over a potential industry that could be the solution to the high numbers of smoking. So that's a big problem, because when you look at what has happened during COVID, where a minister was given powers to decide what to ban and what not to ban, we're still living with those consequences. So for me, that is one of the most difficult things to digest, that the Department of Health could even think about asking for something like that, especially for an industry that we believe the health department does not understand. You know, I know there's issues of an advertising ban, there's public vaping ban, all of those. So Kurt, just tell us about the ones that bother you the most, and also tell the viewers that the penalties that come with some of those infringements, because some of those are just ridiculous.